Hello, I am Dr. Bishash. I am a doctor of this nerve clinic. May I confirm your name and age, please?
Yes, I am Will Smith, 65 years of age.
Nice to meet you. How can I address you?
Well, you can tell me, Will.
Okay, Mr. Will. I have got a letter from your GP saying that you have tremor on your left hand. Is it right?
Yes, yes, doctor.
Going to
Yes,
take detailed history and all the information during our discussion will be remain confidential. So, is it okay for you?
yes, doctor. Yes.
Can you please tell me in your words what is happening with you?
Well, doctor, actually, it's nothing new. Okay. I have actually have been some tremor in my hands, some shakiness of my hands. Okay. That's around 4 to 5 years. Okay. Uh, it's not new, but sometimes it's the right arm, sometimes it's the left arm. Okay, and but however, usually it went came and go. But I think that for the last 5 or 7 months, I think it's gradually deteriorating. Okay, and now I feel it's more now for the last 15 or 10 days. I think it's now more on the left arm
Okay, I am
is
sorry
shaking.
to hear that.
And another thing is that my father is diagnosed with Parkinson's. I saw him having dangerous shakiness, and he was just incapacitated. And I'm not sure whether it's the same with me. I'm very frightened.
Okay, I'm sorry to hear that. You said that you have a history for 5 years, and it is
Yes.
affecting both of your hands alternatively.
Yes.
Uh,
Sometimes both hands, sometimes only one hand. Okay.
okay, and any parts, legs or anywhere.
No, it's your hands. And I think you since you told that other parts, I had think sometimes I have some shakiness in my head also.
Okay, and which part of hands is affected? All over the hand or just a part of? Can you show me that?
I think it's more or less the whole hand.
Okay, and do you feel it is shaking all over all the time or just when you are doing any job or when you are doing nothing or when you are going to do something?
Yes, I think that sometimes when I change my posture, okay, I think that sometimes it's more, okay, and I haven't noticed that whether it's better on rest or something like that.
Okay, and have you noticed that what brings this type of shakiness?
I haven't noticed, doctor.
And when this start, for how long it persists?
Well, around I think around 10 to 20 minutes.
And after that it ends, it goes away totally.
Usually, doctor.
Before the onset of this shakiness, do you feel any warning shot like any headache or any changes in the vision or any abnormal sensation?
No, doctor.
During the episode, do you feel anything abnormal? Any sweating,
No,
any hunger,
no, doctor.
any racing or pacing of your heart?
No.
Okay. And when this shakiness occurs, does it shake very excessively or just some only a little?
I think it's moderate, doctor. I cannot just tell you that
Can you
how
show me that
much I
how
feel.
do you feel when the shakiness comes?
Uh, well, how can I show you, doctor? No, well, but I think it's it's uh, it's quite serious shakiness, doctor. Actually, sometimes uh, that's all I can tell you.
Do you feel any changes in the sensation during that time?
No, doctor. I don't feel any change in sensation.
Any pain?
No,
Any cramping?
no,
Okay. Have you noticed that holding anything makes it better or worse?
no, no, doctor. But I feel that at times anxiety makes it worse.
Okay. And uh, when it comes, you said that it is always present, even at rest or even you are doing any works.
Yeah, yeah. Usually when I take any specific posture, okay, with my hands or something, or want to do some work, I think it increases.
Holding a cup of tea or holding a glass of water.
Yeah, I think at times it increases a bit, but not that much.
How many episodes do
I'm
you
not-
feel?
Yes, now I'm having much more episodes. I think last month I had around 10 to 12 episodes.
Okay. Do you have any headache?
No, doctor.
Any changes in your vision?
No,
Any rash anywhere in your body?
no,
Any loss of consciousness?
no.
What about your appetite
It's good, doctor.
and your weight?
Quite good.
Okay. Any hot or cold preferences?
No, doctor.
Any cough,
No,
shortness of breath,
no,
any racing or pacing of your heart,
no,
any lumps or bumps anywhere in your body,
no, doctor.
any joint pain,
No.
and do you feel that this is progressive or this is becoming worse day by day?
Yes, doctor. I think that it's getting worse day by day, doctor. And I'm afraid I have Parkinson.
And can you tell me that your partner said that you shake at night during sleep or not?
No, doctor. I actually live alone, so I don't know.
Do you have any problem with your balance?
No, doctor.
Did you ever got any injury to your head?
No.
Okay. And do you have any past medical condition that you would like to share?
Well, doctor, I have some high blood pressure issues, and for that, I actually take some beta blocker like atenolol. That's all. And previously, I went to another doctor actually. So he gave me another for this shakiness. I went to another doctor actually. He gave me another drug, another beta blocker, I think. But I felt very much washed out after taking the drug, so I don't take the drug anymore.
Sorry to hear that. And can you remember that? Did the drug help you at all?
Well, doctor, might be. I think it might help, but actually, I felt so much washed out, so much tired, irritated. I just gave up the drug.
Okay, I will consider it. And, do you take any other medication?
No,
Okay. And any herbal products?
no,
Any over-the-counter medication?
no.
Do you have any allergy to any medication?
Sorry,
Do you have any allergy to any medication?
no, no.
You said that your father had Parkinson's disease. Does any of your family member have this type of symptom?
Well, my mother had the symptoms shakiness like me, not like my father's. Okay, that is all. I have seen her just having this time of shakiness while doing any work. Sometimes shakiness of the head.
Okay. And may I ask you a few more personal questions?
Of course.
Do you drink alcohol?
Yes, doctor. Well, there is one thing actually, doctor. Uh, when I drink alcohol, I think I feel quite good, and I feel that it goes away a bit. Okay, so that's one thing. And usually when whenever I feel that I'm having shakiness, I actually drink 2 to 3 pints of alcohol and I feel better.
Okay. And do you ever had any binge drinking?
No binge drinking, doctor.
Yeah, actually, do you know the social limit of drinking?
Yes, I think that it's 14 to 15 pints per week, and I usually drink less than that.
Okay. It's actually 14 units per week.
Yeah, yeah.
And do you smoke?
No,
May I know that what do you do for living?
doctor. Now I'm a retired person. Previously, I was a school teacher.
And do you think that you need any social support or any economic support?
No, doctor. I don't think I have 2 children and they are quite helpful.
Do you drive?
Yes, doctors. And sometimes I feel some difficulties in driving.
For this, we will recommend you stop driving until we are quite sure that what is happening with you.
Okay, doctor.
May I know that what is your concern?
Well, doctor, is it Parkinson's?
Okay, to tell you exactly, we need to examine you, then we could give you the best answer. And as far as I have taken your history and as your symptoms, you have your mother had this type of symptom, and also you have this type of symptom, and that symptoms arise when you do certain activities. So they are likely that it is not Parkinson, and we are thinking that you are most likely having a condition. Sometimes we call it benign essential tremor. That is, it is not so much harmful, but rather distressing. Do you get me?
Yeah, yeah. I'm getting you.
So for this, we are going to give you some medication, and you said that you have some problem with some beta blocker previously. So we are going to give you another medication, and we think that this will help.
Hello.
Hello.
Yeah, yeah. Yeah. Can you please repeat?
Okay, as you said that you have some problem with the beta blocker, we are going to give you another medication and hope that this drug
Yeah.
will help you.
Okay.
And also that we are going to do some blood test now, and after
Okay.
giving you advice on this medication, we will
Yeah.
follow up, and if it seems that it is not improving, then we may need to do other tests also.
Okay. Well, doctor. Actually, is it treatable, doctor?
Actually, this runs in family, and this is not totally curable, but this is something suppressible that we can control this condition with some medication.
Okay. Okay, doctor.
Do we have any
Thank you, doctor.
question?
No, doctor. Thank you.
Thank you.
Well, that was well done. Well, what is your diagnosis here?
Okay, for this gentleman, my first differential is this is a case of benign essential tremor that is related to his posture, or I also consider this is a case of cerebral syndrome, as he is also an takes alcohol. And other than this, I will also consider some posture related cramping of his hand.
Okay. Well, so what should be the treatment in this patient?
There are options like beta blocker like propranolol, then topiramate, and other than I forgot another name, but this
Primidone. What about primidone?
okay.
And I think this patient told about some feeling washed out. What to do about it?
Okay,
After I
with beta blocker,
from
he has problems, so I'll go for that another option.
Okay, well, I think many patients can feel washed out, and I think it's better to ask about his dose. Okay, at times when we start at full dose at the very beginning, uh, people feel washed out. They stop taking drugs. But if we gradually increase the dose, at times the compliance is better. So I think that's also an option. Okay.
Okay.
And well, I think that was quite well done, and the case was rather straightforward, I think. But you ruled out other causes as well for the tremor. I think suppose if it was associated with any thyroid issues, then what would be the diagnosis?
Associated with thyroid issue,
Yeah, this shakiness.
that is hypothyroidism.
No, I think thyrotoxicosis is more associated with shakiness.
Yeah, thyrotoxicosis and hypothyroidism both are associated with it.
Yeah. Well, well, okay, that's all right. And you took well. There is one tremor. Actually, we know about all these things, Parkinson's, but I think you could have asked about Parkinson's more detailed. Okay, that's one thing. That do you have any difficulty while initiating your movements? Any problem while rolling your bed since you live alone? So I think these issues could have been asked. And do you think any there? Huh?
I should have ruled out it any changes in the
Yeah,
memory.
and and if you have any problem while shifting from while changing your posture or something like that, okay, these questions should have been asked because at times, although I have told about head nodding, but there can be some Parkinson's elements is present as well. So this could have been should have been asked, I think. Okay,
Yes, yes.
and you yeah, and you asked about many all things about cerebellar. That's all well done. You ruled out malignancies of paraneoplastic syndrome, cerebellar, other causes like alcohol, everything. That was well done. Another thing that I have came along recently that can cause tremor, that is rubral tremor, and this is associated with multiple sclerosis. Okay, so this can be a
Yeah,
rare case, not very rare.
rubral, I
Rare
think
case.
rubral tremor present both on that is called resting and action.
Yeah. It's
Is it
present both on resting and action.
home tremor or rubral tremor?
Sorry, what?
Home tremor.
I think it's rubral tremor. Okay, I think so. I will again let you know. Okay, but this can be associated with multiple sclerosis. Okay. Hmm. So this you actually ruled out multiple sclerosis. So by taking history, but I'm just telling it that we might need to be careful about that as well. Okay. And other causes were ruled out very well. History was also taken well, but I think that not detailing Parkinson's was a gross mistake because he was very anxious about this disease since his father is
Yes,
affected by
yes.
this. Okay, so that was I think important, and other all other were okay, all right, okay. So that's one thing I think should have been evaluated much more. You know, do you yourself have any more topics to understand
No, I
or
can
to discuss?
remember much.
Okay, that's I think
Any
quite well
calamitation
done.
associated with high pressure?
Sorry.
Any subthalamic lesion associated with high blood pressure?
Yeah. Well, now I've just got into rubral tremor. Actually, rubral tremor actually it's severe tremor and marked worsening with movement. Okay, and another thing I think it's also a remote possibility, but can be asked. That is any mood issues. Okay, sometimes lithium can also cause tremor, drug-induced tremor. Okay. Hmm. So just asking about mood issues I think that can be important. Okay. Hello.
Yes, yes, I can hear you.
Okay, I think that's all. Just mood issues along with other issues, and Parkinson's. I think you must have excluded it very well. And rubral tremor is just for academic discussion. I don't think that it's very uh, possible in this case, but I'm just telling it for knowledge purposes. And I think that's enough for discussion. Okay.
Okay.
Okay. Okay. Thank you.